So hello everyone and welcome to the channel, and in my today's video I am sharing an amazing global supine leg traction technique for the patients who are dealing with the pain in the back area or in the hip area. तो जितने भी पेशेंट्स हैं जिनको कमर दर्द है या जिनको कूला दर्द या घुटना दर्द है उनमें टेक्निक बहुत ज़्यादा लाभदायक हो सकती है. तो लेट्स स्टार्ट विद द प्रैक्टिकल डेमोन्स्ट्रेशन ऑफ दिस एक्सरसाइज. So for the practical demonstration, the patient is in the supine position and the therapist has to stand at the leg end in a step standing position. Now the therapist has to lift the patient lower limb into the flexion, and after lifting the bilateral leg, the therapist shift his body weight backwards and lean his body weight backwards to give a traction effect into the lumbar spine, hip area and knee area, and hold this position for 20 seconds. And after 20 seconds, the therapist rotate the patient bilateral leg into the external rotation, and after meeting an external rotation barrier, the therapist holds this position for 20 seconds and return back to the normal position. So you have to the therapist has to lean his body backwards to give a traction effect, and after 20 seconds external rotate the leg, and if a barrier is found then hold this position and continuously give a traction effect to the bilateral lower limbs and hip area, and after 20 seconds increase the external rotation ranges, and in the same way add a traction effect and now internal rotate the hip joint, and after meeting a barrier hold this position. When the therapist feels the barrier is breaking or losing, increase the internal rotation ranges with the traction and relax. Again, traction by the use of body biomechanics, and external rotation, internal rotation, external rotation and internal rotation, and relax. So what are the steps? I briefly explained again. The therapist has to lean his body backwards to give a traction to the knee, hip and lumbar area. Hold this position for 20 seconds, and after 20 seconds move the bilateral lower leg into the external rotation ranges, and if a barrier is found hold this position for 20 seconds more and return back to neutral. Again traction and internal rotation, and hold this position for another 20 seconds and relax. So try this amazing technique for the patients who are dealing with back pain, hip pain and knee pain, and let us know your valuable feedback in our comment section. Till then, stay connected and thank you.